Dr. Ilona Fotek is a biological dentist who perceives the mouth as the gateway to the body. She takes a holistic approach to oral health, and she's going to tell us how some health issues like fatigue, skin, and gut problems start in the mouth. This is part one of a two-part series because we had so much to cover. Let's dive in. Hey there, and welcome to the Cinnamon Effect podcast. I'm your host, Kimberly, and I'm thrilled to have you with me on this vibrant journey of discovery and growth. This podcast is your go-to space for embracing intention, where you'll find clarity on your unique path, deepen those meaningful connections, and unleash your creativity like never before. We'll explore how to build unshakable confidence and celebrate the beauty of gratitude, all while savoring the calm that consistency brings to our lives. Thank you for being with me. Let's sprinkle a little cinnamon into your day and make life sweeter, healthier, and more fulfilling. Welcome to the podcast, Dr. Ilona Fotek.
Hello, nice to be here. Thank you so much for having me. I appreciate it.
Oh, I'm so excited to have you here. I was recently in your office and I learned a lot. I learned a lot about what I was doing wrong, and maybe I was doing a couple things right, but it was such an amazing experience. So I'm excited to dive into all of this with you. What is something people are doing every single day for their teeth that's actually harming their overall health?
Mm-hmm. It's a great question, and thank you so much for bringing it up, because I think we can share with a lot of people and spread the word and make them correct what they're doing. First of all, I think it starts with a diet. And a lot of times what I'm having right now is patients coming to my office with a lot of erosions and acidity on the teeth visible. That's due to the diet. Drinking acidic beverages, then scrubbing that acid over the teeth. So like, for example, electrolytes. Electrolytes are very popular nowadays, right? And those electrolytes contains the citric acid. So drinking it throughout the day, that citric acid just stays on your teeth for a while and just lowers the pH of the teeth. And that lowered pH is affecting the teeth, making them more porous and washing out the minerals. And then if you're brushing your teeth after you just drank that electrolyte powder mixed with water, then you're scrubbing that acid over the teeth.
Okay, so this was mind-blowing to me when you first told me this, because you asked what kind of things I was putting in my water. And I'm like, I'm thinking I'm doing the right thing, right? So the electrolyte powders, and most of them do have citric acid, because now I've been on a journey here looking at this. So you're not supposed to brush it off. Are you supposed to do like a mouthwash or something like that to get it off?
Absolutely. You can do the mouthwash, or you can simply just put a little bit of salt in your mouth and that will raise the pH.
Oh, interesting. So just kind of like put a little salt, like rub it on your teeth, or no?
Yes.
Okay.
It will mix with your saliva. And that saliva with salt will buffer that citric acid.
Wow. So
simple.
Should you do the same thing if you're drinking, I'm not a coffee drinker, but if you're drinking coffee or water with lemon?
Absolutely.
Okay.
Absolutely. After kombucha, after anything acidic, that's ideal. And I think it's super easy because you can carry a little container with a little bit of salt, and then you can mix it with a saliva.
Okay, so interesting. And most of us we're letting that sit just on our teeth all day.
Right, exactly. Or we're drinking coffee all day long, right? So that's constant acid. And that's another thing. I think we have to look at what coffee we drink. A lot of coffee has either mold, toxicity, and if it's a heavy roasted coffee, that's more acidic. So I would recommend medium roast or light roast. If you're drinking coffee.
Right.
I like coffee.
Yeah. And do you have a mold-free brand that you like?
There's few of them on the market. They're constantly popping up. I look for the flavor as well. So I bought recently a few of them and we're just testing the flavor.
Yes. Yeah. I think it's specific. My husband's a big coffee drinker, so I bought him some mold-free, different coffees. And he's so particular that he's like, that one doesn't taste good to me, so I think that's a journey of his that he's going to have to go on.
Yes. I like the espresso strong one, but I have to fine tune it and make it like a light roast.
Yeah. What I thought was so interesting about your approach is that, I think in modern dentistry, they're kind of looking at the mouth as completely separate from the whole body. And you are a biological holistic dentist. So maybe explain what that is and how your approach is so different.
Absolutely. So first of all, I just wanted to introduce myself. I am a general dentist. I love general dentistry. So what it means is I do a lot of fillings, crowns, bridges, veneers, all kinds of cosmetic dentistry as well. But I have branched out and learned a lot and attended numerous courses and academies, holistic academies, where I could learn the different approach. Because it always strikes me, why are we implementing so many chemicals in dentistry? Why we cannot make it a little bit more holistic, more natural? What can we change to improve health and not dump chemistry in our mouth? So a lot of courses involved, and I think it's very beneficial to patients. And it just makes me more happy knowing that what I'm doing is actually not harming patients. So going back to your question is what means holistic dentistry is a different approach, having less chemicals in simple things. Like if I'm recommending toothpaste, it needs to be more holistic. It needs to have less chemicals, no fluoride, right? No sodium lauryl sulfate. Whether it's a filling, it needs to have no fluoride as well and no BPA. That stays in your mouth, hopefully all the time, right? All those years. So we cannot have those chemicals leaching to your body. And of course, I'm removing mercury in a safely manner. So that's super important to be aware how poisonous can that mercury be while we as a dentist, general dentists, are drilling it out in the mouth. It's such a broad aspect, like I can go on and go on.
I love it. I love it. Well, that's interesting. I didn't know there was BPA, like BPA from plastic that is in fillings. Who knew that? I didn't know that.
Yes. And there's only a few companies that actually tested and have on the market composites that do not have that BPA.
Wow.
And it's a hormonal disruptor. So imagine young kids, right? Young girls having composites placed in early ages, and it can be disrupting to hormones as well.
Wow. Those little things and those little shifts, that's what I love, the intention behind what you're doing. So I want to talk a little bit about your process because you tested my plaque. You're testing it under a microscope. What are you looking for?
So we took plaque from your mouth, your teeth, and we put it on a microscope, and we're looking at different type of bacteria. We all have bacteria, right? And it's all about the balance. When we're looking at the microscope specifically in my office, we're looking not to have spirochetes. Spirochetes are very aggressive bacteria. They look like crazy on steroids bacteria. They're jumping. In my office, we get excited when we see those, but it's not funny. So those are actually aggressive bacteria. They can cause a lot of issues, mainly immunological issues. They are under the same umbrella as Lyme disease. Not necessarily they will cause Lyme disease, but they are lowering immune system. They will cause periodontal disease, gum disease.
So how do you troubleshoot that when someone has spirochetes? What protocol are you giving them?
So we have a tendency of being more aggressive with cleanings, in-office cleanings more frequently than typical the patient would have. Then, of course, ozone therapy, ozone flashing with ozonated water, ozone gas underneath the gums, special products, special mouth rinses, and really spike up the regimen that the patient has in home care.
And you can get rid of them by doing all those things.
Absolutely.
Okay.
And of course, we have to combine it with proper diet and hopefully working with holistic physician as well.
Mm-hmm. So in your treatment, you have the ozonated water, which you can't even tell a difference. It doesn't taste any different, but it's got that extra power to it, I think.
Exactly.
The ozone is really good for you in general. Like I love ozone. Any way I can get it.
Yes. So oxygen is O2, ozone is O3. So it's super powered oxidative agent. It's antimicrobial. You can actually smell it. If you smell it, you kind of like choke on it. So inhaling ozone is not healthy. So we have to be careful. But water is very safe. It's actually very helpful, especially if someone has stomach issues, stomach ache, those bugs that nowadays a lot of people have. So that's very helpful. And that's something that we always offer to our patient to taste, to see how it feels and just enjoy it.
I don't remember the actual toothpaste that the hygienist is putting on. Do you make that?
Yes.
Okay.
Yes.
So tell me about that.
Yes. So our polishing paste that my biologic hygienist is using contains bentonite clay, calcium, food grade calcium, and essential oils. And we have different choices based on the patient's preference. It could be On Guard that comes from doTERRA or Young Living, which contains cinnamon, rosemary, clove, or we can have orange or peppermint, chamomile, or just plain paste.
I feel like maybe I just had plain because I'm not recalling like a particular flavor that I remember.
Oh, did we forget to ask you? Next time we'll pay more attention.
It could have been in there, but I think, there was a lot going on and a lot of it was a different experience.
Right.
It was lovely. I had a neck pillow. I mean, it was like very, very special. And I was in there for a while, like very, very thorough and is what I noticed. And even you were asking about blood work and supplements, which I'm actually getting revised blood work. So that's why I haven't sent it to you yet.
Okay.
But so tell me about how you analyze blood work when it comes to oral health. Like, what are you looking for?
So it is very important to make sure that the hormones are stable, that the vitamin D level is stable. Iodine, right? If you have any bacterial inflammation in your system, it will be visible also in the blood work. So the blood work will also show us if you have inflammation markers. So systemic diseases can reflect what's going on in your mouth. Right? Like, for example, periodontal disease, gum disease will elevate the inflammation markers that will show in your blood work. Hormones are super important. Estrogen, progesterone will affect how your gums behave as well, whether you lose bone in your jaws as well.
Wow.
Vitamin D level, if you have too low, that will affect also the bone in the jaw. For example, we have a lot of older generation patients as well in our office. My husband is a periodontist. So we look at the vitamin D level because if my husband is placing implants, it's super important to have that vitamin D level corrected.
Wow. So you take a look at someone's blood work and you're seeing some issues. How are you kind of guiding them what they need to do beyond the mouth?
So I'm not a physician. I would like to closely work with a physician of that patient. If not, I refer to the physician, but I will always make my recommendation, what I think they should do, whether it's increasing the level of a supplementation or changing the diet.
Do you have some supplements in your office as well?
I do. I do have probiotics, vitamin D, vitamin C, liposomal, detoxification supplements, especially for patients that have heavy metals. And that's another aspect. I always recommend heavy metals to be tested.
Because you're probably seeing that with taking out the mercury.
Exactly.
Which are people still coming in with the mercury
Absolutely.
fillings?
Every day.
Really? Every day?
Every day.
Because conventional dentists are not really using the mercury anymore, are they?
No. Well,
but they're still in existence because people are walking around from 20 years ago, right? That have.
So I have to tell you, in certain facilities, I think more rural facilities that are driven by insurance, Medicaid, or some other form of organizations, they are still placing mercury fillings. And it is insane. But fortunately, the government is bringing it up to attention. Actually, dentists are bringing it up to attention to the government to completely seize that.
Wow.
So hopefully it will happen because absolutely it's not safe.
So people, when someone comes in, you say, we need to take this out. We need to safely remove this. And then you get their heavy metals tested to see where they're at.
Luckily, most of my patients are actually seeking me to have them removed. So I really don't have to tell them. They know they have to be removed because they know it's not safe. They've done some research. They feel that they need to be removed. I mean, to me, it's a common sense, right? You have a mercury, it's poison. You have it in your mouth. Why would you?
Yeah. What's that process like? Is it pretty easy to take them out?
It is very
replace?
easy. It is a setup that has to happen. The patient needs to be completely protected, which means rubber dam, which is a shield that goes around the mouth. Head is covered with a protective cap. The whole body, we have full coverage, so there's no particles of mercury ending up on the clothing. And of course, oxygen nasal hood. So the patient can actually breathe oxygen instead of vapors.
Wow. That sounds intense.
But it goes fast.
It does.
Yes. It's a little bit more difficult if someone is claustrophobic, but we always do it really fast.
Yes. Yeah. You're a pro. I mean, you've got it covered. If the mouth is the gateway to the body, what are some of the health issues that can actually start in the mouth, but show up as skin issues and fatigue and gut issues?
Periodontal disease is the big thing. And again, that periodontal disease will show, first of all, we see the bacteria. I see it on the tongue. I see the saliva is thick and foamy. There's a lot of disbalance of the bacterial flora. And that will increase the inflammation markers in the blood work. That has exponential reflection on the heart. So people can get heart disease, stroke. Of course, women can have hormonal changes, hormonal disruption. It can affect pregnancy. And it's just overall weakening, brain fog, immune system to be lowered.
Wow. And how are you analyzing, similar to Chinese medicine, when they are looking at the coating of the tongue? You can tell a lot by that, right? So maybe talk about that a little bit, because I always find that so interesting that, even I notice when I say I'm not feeling as well, my tongue looks different, right? So if you want to dive into that.
Yes. So I look at the shape. I look at how mobile it is, which direction it goes, right and left. I look at the color, smoothness or roughness of the tongue, and of course the coating. So we know that based on Chinese medicine, depending where the changes are and what the changes are, we can correlate it with overall health. So for example, if there are changes, whether it's color or roughness on certain location of the tongue, that can correlate with organs. In the middle, it's spleen. The tip of the tongue is heart and lungs. So that's what we look at. That's what I look at. And coating, it can correlate to disruption of the guts bacteria.
Like maybe candida.
Absolutely.
Yeah.
Absolutely. Yesterday,
That's a big one, right?
Yes. Yesterday, I had a patient with coated tongue, almost like black. So of course, I have a heavy discussion with the patient. What do you eat? Do you have a physician? Do you take probiotics? And things come up as the conversation goes along.
Wow. Yeah. What are you eating if you have a black tongue? Because we want to avoid that.
Right. Well, first of all, yes, diet, probiotics, scrape your tongue gently. And it's all about gentle. Some patients are super vigorous. They want to scrub it off, and it's not good either. Everything needs to be in a moderation.
Interesting. Yeah. Because, okay, let's talk about that a little bit, because you did give me some mouthwash, which typical mouthwash like a Listerine is not good, right? Because it contains alcohol.
Correct.
Okay.
Alcohol, sodium lauryl sulfate, or triclosan, which is heavy antimicrobial. But it's about the balance, right? And not to be too harsh. So it has to be gentle. I would rather use plant-based products instead of alcohol or harsh chemicals. So typical Listerine, Crest, those are full of dyes and other chemicals. So other products that I use is Stella Life that contains calendula, arnica, and other homeopathic remedies.
I like it. I really like it. I was not using any kind of mouthwash, but I do really like that. It's like herbal kind of tasting, but pleasant.
Gentle.
Yeah,
Yes.
I think very pleasant. So maybe let's dive into the products a little bit, because I want to know what you think of a couple different things that I've heard about, or should we do this? Should we not do this? I know you love the tongue scraping. So talk about maybe the best tongue scraper.
So the tongue scraper, because it's collecting all the debris, we need to be able to clean it properly so it doesn't get nasty. Plastics, it's a no-no. I would use either stainless steel or copper. And those are easy to clean and maintain them well. Just simply soap and water and store it dry.
Okay. Yeah. Just like a hand soap, right? You can
Absolutely.
use. Okay.
Exactly.
Yeah. Don't forget to clean it once you're scraping.
Yes.
Make sure you clean it. Are you cleaning it after every use?
Every use.
Okay. Because you don't want
Absolutely.
anything lingering on there.
No. And the same toothbrush. A lot of patients don't know that you have to clean your toothbrush.
Yes. And now talk about that. So how often are we cleaning it? Every day? Every time. See, I'm definitely not cleaning it every time.
Every time you should use a soap and water and rinse it off. And then once or twice a week, you should soak your toothbrush in hydrogen peroxide. Just literally soak it overnight, 3% hydrogen peroxide.
And get that thing really clean.
Yes.
Especially if you've been sick.
Exactly.
Right? Or have something going on, clean the toothbrush.
Yes.
Yeah, I'm definitely not doing it every time, but I have thought about it. Or like, I do it every so often, but that's not enough.
Right. Well, nowadays we have so much going on in our lives, right? We forget about those little things.
Yeah.
Little, but the big things. But think about also retainers, like retainers, night guards, all those appliances collect a lot of debris. I have a lot of patients, they didn't even realize that they have to brush them.
Oh my gosh.
They just, put it away, take it out, rinse it under water and put it away. No, you have to take a soap and water, brush it. And the same thing, soak it overnight, at least once a week in hydrogen peroxide.
You informed me on that because I was actually brushing my Invisalign with toothpaste. And you said, no, that's not going to do the trick. And here I thought I was doing like a great job brushing this with toothpaste. So I'm using I like my Branch Basics hand soap, the antibacterial soap. And so I'm just using that with water.
Perfect.
And cleaning it that way.
Perfect.
Yeah, because I don't let's be honest, like you can smell the retainer sometimes and you're like you got to keep that clean. So I'm shocked that someone was like, didn't know that you have to do that. Okay. So what about oil pulling?
I think it's a great thing. Personally, I don't do that because it requires time. Think about it. Originally came as a sesame oil and then it transitioned to coconut oil, which I think coconut oil is amazing. But you have to do it for at least 15 minutes in the morning. If you have time, perfect. Hold it, swish it, hold it as long as you can, at least 15 minutes, and then spit it out. And that's the first thing you do in the morning before you brush your teeth.
Yes. I got into it for a while, oil pulling. I've since tapered off, which maybe I'll revisit that. I feel like it whitened my teeth a little bit.
Yes, coconut has those properties.
Okay.
So absolutely it can whiten very gently. It's pulling the toxicity. The research shows that it's also taking away some of the staining. I'm not so sure. Like I said, I don't personally use coconut oil, but some of my patients do.
Yeah. More for me, it's like the consistency of that oil in my mouth is like, after a while, it's warm and I'm kind of like grossed out by it. But I did think it was good when I was doing it.
Yes. No. And it's moisturizing to the mucosa.
So would it be like good for the gums?
Absolutely.
Okay.
Absolutely.
I may
and
get
it's
back into it.
antimicrobial too. It has very gentle antimicrobial effect.
I feel like you could habit stack that with like a red light mask and like oil pull and, maybe do some other things at the same time.
Exactly.
Keep your mind off of it.
Yeah.
If you're just thinking like, my son he would get so like, because he couldn't talk for 15 minutes and he's like, what do you have in your mouth? Like, what are you doing? So it was just funny, but yeah, I might get back into that.
Yes.
What do you do any kind of stain removal on the teeth or any kind of bleaching? Is that something that you do? Okay.
So when you get hygiene appointment with my hygienist, and of course that bentonite clay, the paste has the whitening effect, like it's removing the staining. We also use a special device. It's called airflow, which has very gentle anti-staining powder that is dissolving. It's not damaging enamel whatsoever. So that's really amazing. And as far as more aggressive, I would say whitening, we do whitening based on hydrogen peroxide.
Okay. Okay. And like with the trays, or is it in the office treatment?
In office, both. It's an office. It's called core. And afterwards you can do the trays, which I think it's great to do the trays as a follow-up, especially for someone who drinks coffee or tea or other products that are staining.
What should we do on our own? I know you talked about doing the little bit of salt if we have something with electrolyte powder with citric acid in it. But what about like I drink a smoothie with blueberries in it and, I can notice it on my teeth. What should I be doing to get rid of those stains?
Well, coconut oil will help.
Okay.
Hydrogen peroxide rinses, dilute it.
Okay, and just kind of swish it around. And
Exactly.
what about the Stella Life mouthwash? Would that work, you think? Or
I don't think Stella Life has any ingredients that would whiten your teeth, but the hydroxyapatite toothpaste will do. Because as a powder, hydroxyapatite is white. So not only it's going to remove the staining, superficial staining, but also make your teeth a little bit brighter.
Okay, let's talk about toothpaste because there's a lot of confusion there. I feel like the first one to come out was Tom's, and then now there's like a ton more.
Right.
So talk about the ingredients that we're looking to avoid, what we're looking to have in it.
You have to be your own advocate and read the ingredients, and don't get comfortable because every few months companies change the ingredients. They add something, they remove something. So Tom's, yes, indeed, it was like a wow effect, something more natural, but actually it had carrageenan. So carrageenan is a carcinogenic thickening agent. So watch out for carrageenan. And it also is very popular in non-dairy milks. So be careful with those. But as the years went by, companies came up with numerous really good toothpaste on the market. The ones that I like is Dr. Jen toothpaste. It has 10% hydroxyapatite. But what's important in that toothpaste is she actually, Dr. Jen, tested it under a microscope in a university facility. So it's not like random company just doing the toothpaste, mixing it up and selling it. It has a proper pH, which is super important. So again, you're not scrubbing the acidic stuff in your teeth. Also, it's not abrasive. So there's a special measurement, the measuring tool that they use to evaluate, assess how abrasive the toothpaste is. Because if you're using something abrasive, you're stripping enamel, the coating, and making your teeth more porous. Therefore, it's going to pick up more staining and be more prone to actually erosions and cavities. So it's all about the proper and low abrasiveness.
I told you gave me the Dr. Jen when I was there. I have not used the toothpaste yet because I was finishing up my other one.
Yes.
But I'm using the floss and I love the floss because traditional floss has Teflon, which we want to avoid, of course. And the Dr. Jen, but I had tried other like natural flosses and they got stuck in my crowns. Like I have some dental work in there, but the Dr. Jen's really is good. Yes.
So initially I started a few years ago with the cocoa floss, but cocoa floss is great. It's silk, right? But it gets stuck.
It does get stuck.
So Dr. Jen is amazing in a sense. Again, it's silk. It's actually Italian silk.
Really? It's Italian silk. I did not even look at it to see.
Yes, it's Italian silk and it's coated with hydroxyapatite. So it makes it more smooth. It's woven-like, so it picks up the debris faster, better, but it's coated with hydroxyapatite. So it's preventing the cavities and it doesn't get stuck between tight contacts.
Do you like traditional floss like that? Or would you rather see people using like a water pick or something like that?
Water pick is never substitute of flossing. It's a great tool if you have a lot of spaces in between the teeth or if you have crowns, bridges, a lot of restorative work. So it's an adjunctive tool that you can use, but it does not replace the floss. Floss is the key. You have to floss and clean in between the teeth, that tight, intimate contact of the teeth.
And are we flossing once a day?
Once a day is enough. Evening is the longest routine that we should spend on teeth. And, you have to properly set it aside and have the steps. Mainly, you start first with rinsing your mouth from any debris throughout the day. Then you floss, you rinse it again. Then you brush your teeth. Then you tongue scrape. And then you can water pick or use mouthwash.
Oh, so you're tongue scraping after you're brushing your teeth?
Yes.
Okay.
Yes.
I feel like I'm doing the reverse.
All right. Now you're changing.
Now I'm changing. It's those little tweaks here. I thought,
yes.
I had braces. I've taken good care of my teeth, and there were still so many things that I learned and I'm switching from the way I was doing it before. So I love that. You've given me so much to think about. What are your thoughts on mouth tape?
I think it's great.
Okay.
If it's necessary, if the patient has a habit of breathing through the mouth, taping is great. But first of all, you have to assess if you can breathe through the nose and not suffocate yourself. What's important is to do nasal lavages, nasal hygiene as well. Because a lot of times, what is the nasal passage doing for us? It's filtrating all the crap that we're breathing throughout the day, right? So the nose will contain a lot of debris and it gets collected and it gets stuck. So we have to rinse and irrigate our noses. We can use saline, we can use colloidal silver sprays, or we can use a little bit of iodine sprays. It will all cleanse and have antimicrobial effect as well. Once we know that nasal passages are open and patent, then we can tape our mouth. And the key is to use a tape that has perforations. So in case you feel like you can suffocate yourself, at least you have those perforations.
Yeah. The cage door isn't locked. Just pull it off your mouth.
Right. And why is it important not to breathe through the mouth? Because when you're breathing through the mouth, you're changing the bacterial flora. You're changing pH of the mouth. The bacteria are actually growing, the ones that are causing cavities and inflammation. I see a lot of patients with gingivitis, which is gum inflammation, red, puffy gums. And I know from the beginning, okay, are you a mouth breather? Yes. Yes. A lot of children nowadays, they're mouth breathers.
Interesting. And doesn't that affect your jawline?
Absolutely.
You would have like a more chiseled jaw if you breathe through your nose.
Right. And it's a different tongue posture as well. And speech and crowding. It's all intertwined.
Yeah.
And as a whole dentist, holistic dentist, I look at it all. It's not just teeth. It's not just gums. It's the whole picture.
Interesting. I think I heard something about like breastfed babies breathe better through their nose, right? They're used to
Correct.
I guess, just breathing through their nose. And
yes, because as you're latching, you're forced to breathe through the nose. But first of all, as a new mother, we have to make sure that the child can latch, right? It could be an obstacle of ligament, like tongue tie, lip tie. That needs to be addressed from the beginning in order to properly latch.
So you do recommend if a child has a tongue tie, get it fixed right away.
Right away.
I addressed that with my son when he was very little. What about an adult that has a tongue tie?
It depends whether there's any effect, a negative effect. So I ask, are there any habits? Do you have any speech issues? Do you have any dietary problems? Do you have sensory integration issues as well?
What is that, sensory integration?
It's a texture sensitivity as well.
Oh, interesting.
My daughter had that as well.
So I have a tongue tie. You told me this when I came to see you, and I have an issue with like textures and things. I don't think it has affected my speech.
But the tongue tie, even minor, even if it's not affecting your speech, it can actually limit the movement. So mouth is big muscle. The lips and tongue is big muscle, and they are opposed to each other, affecting the position of the teeth. So if one is forcing and stronger than the other, it can actually cause crowding of the teeth and moving the teeth in that direction that is weaker. So if your tongue has a tongue tie, right? If your tongue is tight and it's not as forceful and your lips are more forceful, you can actually move the teeth inwards and have them crowded. So it's all about the balance.
Yeah, it affects everything.
Yes.
You wouldn't think that it's a big deal.
Right.
And I think maybe when I was younger, people weren't really addressing tongue ties.
No, not as much as we do. Now we know more. Airway is a big thing for all of us dentists. And I'm so grateful. I see a lot of children nowadays, and we can change. We can change people's life as early as possible. I have a 4-year-old right now in my practice that we are implementing orthodontic appliance. It's Vivos appliance. It's a growth appliance. It's super easy. Actually, he almost treats it as a binky.
Oh,
He
really?
loves it. He loves it. But I was thrilled to see the difference and was able to compare scan of his mouth and teeth from 6 months before and now, how much of expansion we've achieved. And he's breathing better. He's feeling better, less congestion.
Wow. The early intervention. Well, let's talk about kids, because where are we going wrong when it comes to kids' oral health?
Well,
I feel like there's probably a lot we're doing wrong. That's why I asked.
As parents, we have to be leaders in the house, right? And we have to lead by example. So if we learn the proper tricks, proper hygiene, proper diet, our children will copy us. And of course, as a parent, we have to double check. I had 2 children. My daughter's 18, my son is 13. And I still have to check my son's teeth. Like, show me your teeth. How did you brush? Go back. Brush with us. We just have to check.
Well, when I came to your office, you said, are you using electric toothbrush or regular toothbrush? And I was using a regular toothbrush. I don't know why. I mean, I had used an electric toothbrush in the past. You recommended, okay, you've got to get the electric toothbrush. So I went home, ordered one. I got one for my son also. And his has a little, have you seen that where it kind of shows the percentage that you have brushed?
Mm-hmm.
He loves it. And this is a kid who doesn't really love brushing his teeth. I feel like what boy does, they don't. They don't like it.
They don't.
And it's like a game for him now. So it's increased the length of time. We were trying to do where you turn over the sand, and he could care less about that, But this electric toothbrush that has this little, light on there, he's like, oh, Mom, I'm at 78%, and he'll continue to brush. So that has really been a game changer just in the last couple of weeks.
Yes, I don't know why people don't like electric toothbrush. I think there's a misconception that you can actually be too abrasive with electric toothbrush. And I try to clear up with the patient. It's all about the force and how gentle you are. And some of the toothbrushes have different settings. So you can set up in a sensitive mode or lower the vibration a little bit. And what I do typically with my toothbrush bristles, first of all, I use soft ones and I put it under hot water to soften even more.
Oh.
If I'm the one that is forceful, I have to counteract it. So what do I have to do? Soften the bristles, right? And it's a lot of the motion, how gentle you are when you're pressing. And it's all about the timing and it's all about following the curve of your teeth to make sure that you're actually brushing all those crevices between the teeth.
Yes. And don't forget the back of the teeth, right?
Exactly. Exactly. And if you're right-handed, we always slack on the right side more because it's just awkward to tilt our wrists.
Oh, interesting. That's so interesting. And is there like a method? Like, should you be doing the bottom first or the top first? Is there any kind of like...
It doesn't really matter, top and bottom, but it's about the motion. So no up and down motion because you can actually create a recession. So either circular motion, or if you're doing the top, put it down. If you're working on your bottom teeth, make movement up.
Okay, these little tweaks. I'm like loving this. How do you address the need for orthodontics with kids? The timing, like multiple cycles people are doing now. Like, let's dive into this orthodontic question.
I actually love the idea of having stages. Because the first stage to me is more orthopedic. Not so much orthodontic because we're not just moving the teeth, but it's more orthopedic. We're working on the jaw formation and development. And that's super important because as you mentioned in the beginning, it's affecting the face, the profile, and everything else, how the child will look later on. So we can start as early as, I think the youngest one I have right now, 4.
Wow.
So you can start with those growth appliances and they can be very non-invasive, kind of like munchies, like chewy. And as you chew, you are forcing the jaw to form better. You're making a movement in a bone and a microscopic effect, I would say. And then you can do also expanders. And then the expanders can be less invasive or more invasive. They can be removable or fixed expanders. We have to expand the palate. Of course, what's important as well is proper habits. Speech, we might have to implement myofunctional therapist. Actually, my hygienist, holistic hygienist, she's certified in myofunctional therapy as well. So we always look like what's causing that crowding, what's causing the underdevelopment of the jaws, right? And we have to also talk about the diet. Are you, as a mother, making sure that your child is eating hard foods, solid foods?
Yes,
now we're in an era of all the pouchies and smoothies. And yes, it's great, but not great for the formation of the jaw. So apples, carrots, celeries, something hard.
Interesting. Yes. We've done a lot of soft, even as adults, I think.
Yeah, absolutely. Because it's easier.
Yeah. It's quick. I'm guilty of that, like the smoothie, craze for sure.
And then going back to your question. So first is the growth implementation, growth appliances. And then if we need to tweak the teeth and alignment, we can implement either Invisalign or braces. But the first stage of their years is the best because the bone is more spongy, more pliable, and you can do so much and perhaps avoid even braces later on.
Oh, really?
I actually, when I was, I think, second grade, I had expander. I never needed braces.
Now, the expander, is that on the roof of your mouth? That
Correct.
apparatus. Okay, I had that as well. I had that expander as well. I had headgear.
Oh, I don't think we're doing it because I learned how to do it, but it was awful.
I think, what's the point of that? I think it was terrible, terrible. I think I have PTSD from the headgear. Yeah, it was not good. And I actually wore it. I was very diligent about wearing it because I was in braces for a long time. I had a lot of teeth, I feel like, in my mouth. And so I remember going to a sleepover and wearing this headgear.
Oh.
And of course, I got ripped apart. People were like, I just showed up with this headgear, I don't know what I was thinking or why someone just said, you know what, just don't wear it tonight.
Right?
You can wear it the next night. You'll be fine.
You were so diligent. But you have beautiful teeth.
I'm a rule follower, but... So let's talk about the gum health because I think that's a big issue. And, I want to know, what are women in their 30s and 40s doing? What are we doing wrong? What do we need to be doing to prevent gum recession?
Hormones. We definitely have to look at the hormones and deficiencies and disbalance. So like I said, vitamin C, super important because it's a collagen formation. So we need to supplement with vitamin C, ideally liposomal, so it stays a little longer in the system and be consistent. Then vitamin D is supporting the bone. Even in Florida, I don't know about you, but I don't go out to the sun. So I don't get enough of the vitamin D, and I have to supplement it. So that's important. And also hormones, estrogen, progesterone. Because as we are aging, and I'm 48, I'm pre-menopausal, I guess. So I have to be very careful about my hormones and check them frequently. Because as we see in the face, elasticity and collagen is affected by hormones, the same bone and gum structure.
So interesting because I don't think about the gums being collagen, I guess, right? Now, can you take it in a powder? Is that a good way of getting collagen?
You can, but nowadays we're hearing a lot of impurities in collagen and absorption issues and actually bloating and all the negative effects. So collagen, depending on which collagen it is, and it has to be broken down into peptides so it's better absorbed.
Okay. And so vitamin C is important. How much vitamin C? I mean, we're taking vitamin C to combat a lot of things probably. So how much vitamin C would we take?
Right. Well, I would say, I always recommend my patients, 2,000 milligrams a day is a minimum.
Okay.
And you can supplement in the form of food or supplementation. But like I said, liposomal is the best. I always like to do things in liquid because the first absorption happens in the mouth, under the tongue.
That makes sense. I'm taking a lot of liposomal things currently. Can you take multiple liposomal supplements in a row in the morning, let's say, or should you space them out? I was actually thinking about this morning. Should I be spacing this out?
You can, but for example, A, D, E, K vitamins are fat soluble. So ideally you should take it with something fatty, for example, olive oil. Whereas vitamin C is not fat soluble. So you might want to wait a few minutes.
Okay, gotcha. That's funny because I know you like the olive oil and I just started taking a shot, not necessarily in the morning. Sometimes I'm midday, trying it on an empty stomach with a little lemon. But now I've got to, rinse my mouth out.
Yes.
Is what I've learned.
Yes, olive oil is great. It's medicinal.
Yes. I know you love it. Let's talk about your whole smile approach and what that is.
I'm so excited about it because we have a tendency of just looking at teeth. And yes, teeth can have amazing or completely negative effect if you have them wrongly sized or wrongly positioned, and it just doesn't fit the mouth. You probably see a lot of women or men who had their teeth done, veneers, crowns, bridges, and they just like look awful or fake, and they just don't belong to their faces, right?
Yes.
Or people can't smile well because the lip is asymmetrical, or they don't like their smile because something doesn't look right on the face. So it's all about the whole picture. It's not just teeth. It's not just the wrinkles that we have around the lips. It's not just whether we have plumpy lips or not. It's the whole picture.
Mm-hmm.
And especially female, I think we're so focused on our faces, and there's nothing wrong. I'm all about beauty and confidence and making it more natural, but making it harmonious so it works together, functions together, and complementing each other.
So what are you doing to achieve that with somebody?
So there's so many different things. I'm all about implementation, something more natural without chemicals.
Mm-hmm.
Depending what the issue is, it could be elasticity of the skin, right? So we can implement collagen, of course, diet, things like that. But besides the diet, something more superficial can be the laser, microneedling, PRF, which comes from your blood, stem cells. There's so many different variations. I don't think there's only just one solution. I think it's a combination of different things that will work towards the prolonging the skin elasticity and slowing down the aging.
Yeah. And it's interesting that you do it in your office because there's an aesthetic component.
Correct.
Which actually makes total sense when you're thinking about all of this and the face and the mouth. And it really does all go together.
Right. Yesterday, I actually had a patient. She is our age, and she said, I don't like the way my jaw is shifted. It's asymmetrical. I'm developing more dimple here. What can we do about it? So, of course, I'm discussing with her possibly threads, possibly PRF injections, microneedling and laser, and of course, teeth correction and alignment correction, because it all works together. And if there's any crowding that affects the bite, the jaw gets shifted to one side or another side. So again, it's so intertwined together, and we have to see it as a whole picture.
So would that be like Invisalign? You would maybe do Invisalign with her and then address.
Correct. Or sometimes, since we are using our teeth all those years, we eat different things, sometimes softer, sometimes harder. Especially Asians, for example, they eat a lot of rice and something hard. Their teeth, a lot of times, are worn down. So as you wear down your teeth, the bite gets collapsed, and then the nasolabial folds are getting more prominent. So instantly we get more wrinkly around the face.
That's like here, right? From the nose down. I'm hearing a lot about that now. I guess when you're 45, that's what comes up on your feed,
right?
Is nasolabial folds.
Yes, and those whatever you call them, jowls.
They call them jowls. Yes. Oh my gosh. I think I told you I like the most natural route possible. And so you and I were talking about the PRF, right? So it would be like you take the blood, it's spun or something. Is that right?
So
okay.
PRF is basically we draw the blood, we put it in a special tube. The tube is pure. It doesn't have any chemicals, no blood thinners. We place it in a special centrifugal machine that spins it and separates the fibrin. That fibrin contains stem cells, your growth factors. And as I'm pulling those growth factors, I can inject them in your skin. Injected almost like with insulin syringe, like people are doing Botox, the same type of syringe, and implementing in areas where we are prone to wrinkling.
Oh, so just specific, like spot treating almost.
Exactly.
Okay.
I can also make it thicker and heat it up, almost kind of like a filler. Very viscous product that I can implement it underneath the eyes. I can also implement it in temples where a lot of times we're deficient, or any other areas. I wouldn't do it for lips because it gets absorbed faster. And as we move our lips all the time, it doesn't last long. Unfortunately, anything natural does not last as long as the synthetic filler, but it can last 6 to, I would say, 12 months.
Oh, wow. That's still a decent amount of time.
Yeah.
Okay,
I've had it on my temples.
Yeah. I feel like I would need that, like under eye, maybe. Let's start, So it's just your blood spot treated in areas where, okay. Yes. I feel like maybe I could do that.
I love that.
What do you think about facial massage and like the buccal massage and facial? Are you into that?
I think it's super important because we use the teeth, the muscles, mesenteric muscles all the time, and we get tensed and we clench, right? We get stressed out. So the muscles get into spasms, and that actually can have an effect on how we smile, how we function, and how we even wear down our teeth. So massaging is super important, not just superficial standpoint, but also on functionality of our face.
I'm very big into that. Something in my 40s that I'm really committed to is like the facial.
Right. Yeah. So gua sha, there are different type of devices.
What are some things that you do, Dr. Fotek? Like, I would love to know. I know you love olive oils. If you want to drop any, of your routines and things that you like to do. I love that.
I have a esthetician in my office, so I try to get facials as often as I can, but it's like a shoemaker without the shoes. So sometimes I'm left over. What time is it? It's 5:00 p.m. I don't even have time.
Right.
But I use natural products. I love eminence. I always take a look at the ingredients. The longer the ingredient list, it's usually not the better.
Yes, you have beautiful skin. So
thank you. But I love microneedling with PRF. I love laser. I've done PRF injections as well. So it all just prolongs the skin to be more elastic and more plumpy.
What's the difference from the PRF injections versus microneedling the PRF?
So microneedling is micropuncture with a device, right? And as you microneedling, you can actually apply the PRF liquid onto, and as you open up the channels in your skin with the microneedling, that PRF gets into the skin and it works on a collagen. And 2 days after, you look glowy.
I bet. I bet. Dr. Ilona Fotek, we covered a lot of ground, I feel like. Did we miss anything?
Probably there's a lot more to discuss, but it's always something. And it's such an amazing era that we know so much more nowadays. We have ChatGPT, we have internet to look for, we share with each other, we meet each other, and then we just talk about those different things. And it's all about nature. And we're growing that nowadays. And we're in a beautiful area, Jupiter, Palm Beach, where it's all about the beauty, right? And functionality, and just be better for ourselves and for others. And smile is so important. It makes you more confident and more open, right?
Smile is so important,
it is.
I think it, like they say, the eye's the window to the soul, but the smile says so much.
Absolutely.
Yeah.
Absolutely. I am so excited for everyone who's listening to that podcast, because we can change people's life, and from younger, and not just smile, it's just functionality and health, airway health, confidence. It's just such an important factor and part of our lives.
You take such a comprehensive approach. And so I really love that. I felt like it was so thorough and intentional, and I learned so much, and I learned so much again today. So I'm so happy about that. So please drop how people can get a hold of you if they want to make an appointment.
My office name is Dental Healing Arts, and I'm Dr. Ilona Fotek. My husband is a periodontist, Dr. Paul Fotek. Our office is in Jupiter. And again, it's Dental Healing Arts, and phone number is 561-626-6116. And I welcome everyone.
Oh, it's a beautiful experience.
Thank you.
You get some little treats when you go in there, and you get the neck pillow, and it's really lovely. It was amazing.
Thank you.
So I appreciate you coming in here today and telling us, really, you gave us the groundwork for what we need to be doing for our teeth and our smile. So
thank you. But it's
grateful.
Such an individual experience, because we all come with a little bit different package, the different luggage and different problems. And I want to make sure that I'm addressing every single person person very individually and just nail the roots and the problems so we can make things better.
Yeah.
Together.
Thank you so much. Thank you for being here.
Thank you. I appreciate it.
Thanks for tuning into this episode of The Cinnamon Effect. If you enjoyed our time together, don't forget to hit that follow button on your podcast app and sprinkle a little love by leaving us a 5-star rating and a quick review. Your support means the world to me. For even more goodness, check out the show notes where you'll find links to some of my favorite products. And don't forget to visit thecinnamoneffect.com to connect with me directly or to grab your TCE gratitude journal, your next step towards a more grateful life. I can't wait to spice things up with you again next time. Stay vibrant, stay inspired, and remember to add a little cinnamon to your life every day.